Welcome back to the Business Spotlight. I'm Pat Dewar. We're having a great show today. I've got my good friend and my chiropractor, Dr. Spencer Shanley from the Keller area, talking to us today about several things that have to do with, well, pain, your pain specifically. If you've got headaches, if you've got migraines, if you have lower back pains, or more specifically, as we said in the last segment, if you know anybody that has scoliosis, a curvature of the spine, he's got a solution that isn't surgical, and it's a tool that has been very effective in saving so much pain from the people that he's been working with. In the Dallas-Fort Worth area and pretty much within the Texas region, he's your guy if you want a solution for the scoliosis experience because of the brace that they have, the Scoli brace, right?
Correct.
Would you agree?
Yes.
So one of the things that I really want to get into today on this segment is, we've talked a little bit about the chiropractic services, but what are some of the real live experiences you guys have had, some stories of the clients and how you've been able to make a difference? Because, a lot of people just don't know anything about chiropractic medicine. They just don't know. But yet, you have seen so much, you've made a difference. How are you making a difference and to who?
Well, that's a great question, and I've been very fortunate to see different people come in my office that have experienced great things happening. So the first story that comes to my mind is, just like I was mentioning about the Scoli brace earlier, that you're investing in your children, and if you can help your child prevent any pain at all, then that's what you want to do. And this is an option for us through chiropractic, is allowing the body to heal itself naturally without drugs or injections or surgery. So this chiropractic care is relieving pressure off of a nerve that's pinched, allowing the body to heal itself. And the first story that comes to my mind is a young boy that's about 12 years old that was suffering of severe migraines for 9 years.
Oh, wow.
He was on 6 types of medications that weren't truly helping per se. You would rather do the medication than not, of course. But in this scenario, he was not able to play football because of his headaches. The helmet would hurt when he put it on. He couldn't study properly. He couldn't function as a child properly. It was affecting him on every avenue possible. He came into our office and we discussed that if we could help him in this change, that she should remember this and share this with as many people as possible. But we can't always see what's going to happen, and we hope that things will happen and change, allowing the body to heal itself. So naturally, we go into this with high hopes. After one treatment, he felt a little bit better, a little bit less migraines, a little bit less headaches. After 2 treatments, just 2, and 9 years of suffering, he no longer has any migraines, any headaches. He's off of all 6 medications, and he's back playing sports and football again. So to me, that not only affected him now, but the rest of his life. Sure. And that is huge to us.
Yeah, well, I know the other thing that I'm curious about is, briefly, you've seen some pretty significant results even with the Scoli brace, haven't you?
I have one patient that recently was braced about a month and a half, 2 months ago, and as a lot of parents would say, it takes longer to really see the results of something like a brace, but this has been researched and proven throughout the world for numerous years. But with our office, as this is new technology in our office, we have a young boy that is 14 years old, has a 35-degree lower back curve.
Okay.
He recently, actually yesterday, came back into our office for a follow-up after being braced, and he now has an 11-degree curve in his lower back, or 69% improvement within 4 weeks or 1 month.
Wow.
So wearing the brace, we take an x-ray after 1 month to see if it's improved by at least 10%, so we have high hopes of the body changing and healing naturally with this brace. And this patient improved by 69%, or actually from a 35-degree curve to 11 degrees. It almost brought tears to our eyes as we were looking at this x-ray, and we know that he's going to have possibly 100% correction with this brace.
Wow, but the national average maybe, or the world average for this brace, is it 10% better, 15%? What are you seeing just as kind of the anybody could experience some benefit if their body will adjust. Is that one of the key factors, is if their body will adjust?
Right, that's what the first month with the x-rays wearing the braces for. We have them come back in to see if it's actually changing. If they're not changing after 1 month, then unfortunately the brace is not going to work. And that doesn't happen too often. We usually have results on 80 to 90% of patients. If there's a case where we know that it's just too far past the point of the bracing, maybe 50 to 60 degrees, sometimes you can have results, but a lot of times you advise the patient that it may not work due to previous experiences. But we do have a great impact and a great result on a lot of our clients that do brace. It can work for all ages, not to mention. It's better to start young because they're still changing and you can affect the growth of the bone. But this brace is good for adults too.
That's excellent. And they'll adjust it to this, in a sense, the size of the person. You don't have to be a small person to actually use this.
No, it's specific to you. So you may be a small, thin individual, or you may be bulky or a little bit overweight. It's specific to each patient to help you.
Very good, very good. Well, like I say, I mean, we're talking with Dr. Spencer Shanley of the Keller area. He's a chiropractor. He's making a difference in that area, and I know he can make a difference in your life as well. Here on the Business Spotlight, one more section. We'll be right back.